Alright, so I've already got my nasal airway in, and I'm going to just do some nasal tracheal suction. I've already hyperoxygenated my patient with a non-rebreather, and I've washed my hands, introduced myself, done all of those good things, so I'm ready to actually perform the suction. So I opened my sterile catheter kit, and I've applied my sterile gloves. So I have one sterile hand and I have one clean hand. I've also filled the little basin reservoir with some sterile saline solution. I've attached the end of my catheter to the suction and placed it on the appropriate amount of suction based on my patient. For an adult, it's -120 to -150. I believe for a child, it's -80 to -100. And with my sterile hand, I'm going to take the end of my catheter. I'm going to stick this in the sterile saline, and I'm going to occlude the thumb port, and that's going to make sure that my suction's working properly. Okay. Once I have that all taken care of, I'm going to put a little, using my clean hand, I'm going to put a little bit of Solugel into my sterile hand, and I'm going to run the catheter through that to get that lubricated, and then I'm going to wrap that around my hand. Now I'm going to insert the catheter using my sterile hand into the nasal airway, and it's going to go into the trachea, and then once we get there, we're going to begin to remove it, and we're going to apply suction, and the whole thing should be 10 to 15 seconds, no longer than that. Okay, so we're going to go ahead and apply suction and remove catheter. Okay, and then I'm going to go ahead and discard of my disposable nasal catheter, and with my non-sterile hand, I'm going to reoxygenate my patient for at least a full minute, and I'm going to do my assessment, which includes vitals, respiratory rate and pattern, SpO2, and I want to make sure my patient doesn't have any questions or concerns. I want to get them positioned so they're comfortable, and then for this patient, I'm going to go ahead and leave that nasal airway in because I will be back later to do more suctioning, and that way I won't cause any extra trauma to the nasal passages.